This lecture aims on how to recognize key physical signs of child abuse. Failure to thrive. Persistent weight loss, malnutrition, and stunted growth can indicate neglect, indicative of child abuse. Poor hygiene such as unkempt appearance, dirty clothes, and matted hair may suggest neglect or emotional abuse. Unexplained facial injuries such as bruises, cuts, or swelling on the face, especially in specific locations like the ears, cheeks, or lips, warrant further investigation. Slap marks or hand-shaped bruises on the face or buttocks can be indicative of physical abuse. Torn or bruised frenulum can occur due to bottle jamming during forced feeding. Scarring or bruising around the mouth may suggest gagging or smothering. Oral injuries such as mouth sores, chipped teeth, and sexually transmitted infections can point towards forced oral sex. Be wary of unexplained bruises or wounds in unusual locations, particularly on the buttocks, thighs, abdomen, or back. Consider the size, shape, and distribution of bruises for patterns suggestive of abuse. Restraint marks on limbs, axilla, or neck may indicate the use of restraints. Loop marks are pathognomonic for abuse and result from striking the child with a cord, rope, or belt. Bruises or scrapes on forearms, hands, or legs may indicate defensive injuries attempting to repel blows. Inflicted burns include immersion burns, scalded burns, and cigarette burns. Immersion burns are burns with sharp lines of demarcation and no splash marks suggest submersion in hot liquid, a potential sign of abuse. Scald burns are the most common burn type in children who have been abused, and the most common causative agent is tap water. Abusive scalds tend to be distributed on the buttocks, perineum, and lower extremities, with clear upper limits and scald symmetry, especially when present on the lower extremities. Cigarette burns are round, well-defined burns with central charring points that can be indicative of intentional abuse. Ear injuries such as bruising, bleeding, or ruptured eardrums can occur due to blows or objects inserted into the ear, suggesting potential abuse. Ocular injuries. Blood in the anterior chamber of the eye, hyphema, can be caused by blunt force trauma to the head. Retinal hemorrhage is a potential indicator of abuse. It can be caused by blunt head trauma. Retinal detachments can occur due to significant head trauma, raising concerns for abuse. Brain injuries. Subdural hematoma, especially if bilateral, can be caused by significant head trauma, often linked to abuse. Abusive head trauma, also known as shaken baby syndrome, is a head or neck injury from physical child abuse. It happens when someone violently shakes a baby or hits the baby against something hard, leading to brain injuries even without external signs of trauma. Symptoms can include irritability, vomiting, lethargy, seizures, and coma. Abusive head trauma may be associated with retinal hemorrhage, multiple fractures of the long bones, and subdural hematomas. Skeletal injuries suggestive of child abuse include long bone spiral fractures, corner fractures, and posterior rib fractures. Long bone spiral fractures are uncommon in accidental falls. Spiral fractures are more suggestive of twisting forces, potentially caused by abuse in children. Corner fractures, also known as bucket handle fractures, are observed in young children and are suggestive of non-accidental injury, child abuse. Most rib fractures in infants are caused by child abuse. Posterior rib fractures, especially multiple and in younger children, are rarely accidental and warrant further investigation. Abdominal trauma is the second most common cause of death in children who have been abused. Severe abdominal injuries are unlikely to result from minor or household trauma. Young children who present with serious abdominal injuries in the absence of major trauma, such as a motor vehicle crash, should be carefully evaluated for the possibility of physical abuse. Sexual assaults include genital or rectal injuries. Bruising, tearing, bleeding, or discharge from these areas can be signs of sexual abuse. Diagnosed sexually transmitted infections or pregnancy in prepubertal children are highly concerning for sexual abuse. In summary, healthcare professionals can play a vital role in identifying and protecting vulnerable children. Maintain a non-judgmental and supportive approach when interacting with the child and family. Remember, the presence of any single sign does not confirm abuse. Report suspected abuse to the appropriate authorities as mandated by law and local protocols.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.